First, we want to make sure we're fully set up and ready to go. We don't want patients to open their mouth only to figure out that there is no flashcards or batteries running low. That happens to all of us. We want to make sure before patients seated, check for the flashcards, make sure the batteries are charged and ready to go. All the setup is appropriate, ready to go. As we talked about, I like to use Columbia retractors for most of the retraction needs. It does cover 80% of all the photos that we take, we use with Columbia retractors. Occlusal UHD mirror as well as buccal mirror. So before I come in, patients usually seated. The mirror's ready to go, retractors here, and we're ready to take pictures. There are times when we know that the mirror's gonna fog and I won't have an assistant. We like to warm up these mirrors so that they don't fog on us, and that's going to be much easier for us to take pictures. We always start by taking smile photos. Look. Perfect. And then we go into retracted photos. Open for me. Okay, hold this for me way at the end and then bite down. Turn this way a little bit. Open slightly. Perfect. And then we ask patients to hold on to that and bring the chair down. I like to do minimal amount as possible, which is why you saw me bend over a little bit, because I knew that I didn't have to go down because we already set that position appropriately. For the maxillary occlusal shot, I always stand from the 12 o'clock position. Patients lay down. And for the mirror, it's important for this to be seated against the bottom occlusal teeth. Open for me. And that allows us to have most distance away from the opposing tooth to create a better shot to have even the second molars in the picture. And for this one, we ask patient to open their mouth big as possible. Open big as you can for 5, 4, perfect. And that's all you need. And for the bottom shot, same thing. The tongue to the roof of the mouth and relax the tongue now. And this way, we push the tongue out of the way. Open big as you can and perfect. We take the buccal shots. We come from the opposite side, position the mirror, put it as far back as possible, and open slightly. Other side, and open slightly. Perfect. During the surgery, I like to use my buccal mirror for occlusal shots of all the pictures we pretty much take. And it's much smaller, and it helps me actually to check for the angulation of the implant from the side as well. So if we were to use a buccal mirror, open for me, position the mirror in the area that I want, and just like that.